Great. Thank you so much, Marianne. Good morning, everyone. And again, welcome. Welcome to this session on personal protective equipment and personal protective technology standards process. My name is Tenor Venema. I'm a senior scientist in the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health and a senior scholar at the Johns Hopkins Center for Health Security. I've had the great honor of serving on the planning committee and now will be moderator of this session. This session will walk through the process of setting standards along the PPE and PPT supply chain, from design and manufacturing through to transportation and storage and distribution to end users. Before we get into this conversation, however, I'd like to spend some time on a recent report prepared by the Product Standardization Task Force that was mentioned in the opening session. This task force was established to improve the efficacy, usage effectiveness, safety, supply stability, and accessibility of PPE designed for use in U.S. healthcare settings by critical infrastructure workers, but also for public protection, in order to reduce infectious diseases exposure in workplaces, in community settings, and to reduce exposure to infectious diseases in workplaces and community settings to address the U.S. standardization system and update it to meet 21st century needs. During the calendar year 2022, as mentioned earlier, the task force met several times, having testimony from subject matter experts who identified PPE and PPT standards gaps, as well as achievements, all of which has been compiled in a report expected to be released within the next few weeks. The task force's findings highlighted the several types of gaps that exist in PPE and PPT standards. These include gaps related to the level and type of protection the product offers, gaps associated with the technology applied to the product, or the product testing capability. There are also standards gaps related to education and information sharing with end users about how to choose, use, and care for their PPE, including about the product's lifespan and how to properly care for the product, as well as the impact of storage on the product. The task force also suggested that low confidence among end users on how PPE adheres to standards may also be a gap. When we look at relating the gaps identified by the task force to the supply chain, we can see that there are gaps along the entire process, right from the beginning of raw materials through to end use. We have put together a visual that you will see on the screen now to illustrate where some of these high-level gaps sit along the supply chain. All of the way on the left, we see that there are gaps in the performance of raw materials used in the construction of PPE. In the manufacturing phase, there are gaps around certification, conformity assessments, fit and size, marketing, sales and distribution, the performance of the raw materials again, product testing for cleaning, and product testing for use scenarios. At distribution, there are gaps in certification of the distributor, certification of the product, conformity assessments, fit and size and marketing, sales and distribution. And we see the same gaps when bridging distribution to users, though there are some additional gaps at this point in the supply chain related to certification of the retailer, selection guidance, guidance around the use and care of the product, and labeling, education, and communication. Finally, to the far right, we then split end users into two groups: workers using PPE in occupational settings and those users in the general public, which you see all the way to the right of your screen. For workers, gaps around fit and size, guidance for selection, use, and care, and labeling and education and communication remain. Notable is a lack of standards for PPE for public end users, those not using personal protective technology in an occupational setting, a major gap. There are no standards for public use along the entire supply chain, something that must be addressed. ASTM has proposed guidance for the selection, use, and care of respirators by the public, but no standards are yet in place and are limited to respirators and do not include the other types of personal protective equipment. Throughout the workshop, the sessions will touch on these components of the supply chain and these standards gaps. For this session, we're going to take a step back and dig into what standards are, what the process is for setting standards, and the relationship that this has with supply chain resiliency, as well as with inspiring innovation. I am very pleased that we have a wonderful and accomplished panel of speakers for this conversation, and I will be inviting each speaker to share their remarks. Each speaker has approximately 5 to 6 minutes to speak, and then we will have a question and answer period. If you'd like more information about each of the panelists, a link to their bios has been posted on the event webpage. You are invited to submit your questions to ask the panel. Please put them in the question and answer window beneath the video player. So I'd like to start off by inviting Dan Ship to speak. Dan was with the International Safety Equipment Association for many, many years, and we are honored and privileged to have him join us today. Good morning, Dan.
Good morning, and thank you for that introduction today. Just to begin, I'm not an engineer. My technical knowledge is pretty much limited to knowing how to operate a car or a computer. But I spent most of my career working for organizations that enable the development of technical standards for electrical products at first, and then for most of the time for personal protective equipment and technologies. I've seen the process up close. I've helped manage it, promoted standardization and standards development in the US and around the world. In the next couple of days, we're going to do a deep dive into the specifics of standards for protection of healthcare workers and others exposed to health hazards. So I thought it'd be useful at the start to talk about what PPE standards are, who makes them, how they provide vital links in the supply chain. So first, what is a standard? Here's a commonly used definition. A standard is a document established by consensus, approved by a recognized body that provides rules, guidelines, or characteristics for product or process for common or repeated use. That definition embraces all the key elements of standardization: consensus, recognition, contents, applicability. PPE product standards set minimum performance requirements. They contain guidelines for proper use. They establish classifications based on characteristics such as size, fit, level of protection. They contain test methods to determine whether these performance requirements are met. Often, a standard will include all of these things. Think about classifications, for example. An air purifying respirator that filters out 95% of particles for a certain size in an oil-free atmosphere is an N95. That's a classification. There are standards for sizing, for selection, for use, care, cleaning, maintenance, training, storage, disposal. There are standards for measuring contaminants in the air, calculating fall distance, for anything that is important to ensuring that the product delivers on its promise of protection. So where do these standards come from? First of all, there can be government standards. There are government standards. Think of 42 CFR 84 for respirators or OSHA standards. These standards are developed through notice and comment rulemakings and are part of the federal regulatory structure. Most standards in the US are developed by voluntary consensus bodies. These bodies can be standards organizations like ASTM or NFPA, trade associations, professional societies, even consortia assembled just to develop a specific standard. What these organizations all have in common is rules, guiding the way they operate based on broadly accepted principles of consensus, including balance of interests, transparency, openness, impartiality, effectiveness, relevance, timeliness, coherence, and everything else. They are voluntary in the sense that they are developed in a voluntary process and adopted by manufacturers or users or regulators voluntarily. But they can also be adopted by regulatory agencies, in which case they have the force of law, just like a government standard. The process of developing a PPE standard starts with the identification of a need. What's the hazard? What's the exposure? What's the potential injury if the PPE fails? What's the nature of the work being done when the hazard is encountered? Workers face hazards that can cause injuries from impacts, cuts, burns, falls, electric shock, from exposure to extreme heat or cold, flames and smoke, noise, chemicals, biohazards, radiation. Workers need PPE to protect their heads, the eyes and face, hearing, lungs, hand, feet, skin, bones. PPE to prevent fall injuries, to make them visible day and night. Whatever the need, there are processes in place for getting the standard from concept to completion. Standards are written by consensus groups that include manufacturers, users, government officials, experts, academics, test labs, consultants. Anyone with knowledge of the product, process, or service, an understanding of how to establish common performance characteristics and guidelines, and a willingness to devote time, energy, and expertise to the process. And the end product is a document that is essential to speeding goods along the supply chain, because the manufacturer, distributor, specifier, end user, and regulator are all using the same language. Standards are the shorthand of commerce. As we examine the standards landscape over the next couple of days, think of these principles. Think of the gaps that you identify as opportunities to improve standards or develop new standards where they're needed. You and your organizations need to be part of the process. Every standards document has contact information. Encourage knowledgeable people in your organizations to participate in standard development. There's not been time to describe the whole infrastructure of standard development in the 5 minutes, but there are online resources that you can get more information. I encourage you to go to sites like the American National Standards Institute, ASTM, to read about their standards processes. A good start that I recommend highly, because I wrote it years ago, is the standards FAQs at safetyequipment.org. Thank you for your time. I look forward to discussions over the next couple of days.
Thank you so much, Dan. Now I'd like to introduce Gordon Gillerman from the National Institute of Standards and Technology. Good morning, Gordon.
Good morning, Tenor, and thank you, and thank Dan for his opening comments. They'll lead into my discussion quite nicely. I am the Director of the Standards Coordination Office at the National Institute of Standards and Technology. NIST is the National Metrology Institute, so when you buy a gallon of gas, we provide traceability to the international system of units to give you confidence that you're actually getting your money's worth out of the volume of gasoline that you purchased, and really underpin the measurement system, and also do technology development here at NIST in critical and emerging technology areas. My office provides the coordination across NIST and the entire federal government for the development and use of documentary standards inside the government and in coordination with our private sector. Dan did a great job talking about the attributes of standards developing organizations that help us have confidence that the best standard solutions come through the process. I've worked in standards since I graduated college. My first job was a product safety engineer with Underwriters Laboratories. I tested and then certified both power supplies for computer products and maybe more consequently here, electrical medical devices. So I have a lot of background in understanding the relationship between the voluntary standard system and the regulatory system of our country and of others. The US government has some guiding lights in the participation and use of standards for federal agencies. They come from a couple of paragraphs from the National Technology Transfer and Advancement Act. And the bottom line, it tells government agencies to participate in the development of voluntary consensus standards and use those standards in lieu of developing government unique standards whenever it can meet their mission needs. There's a website called standards.gov that has a link to those provisions, and maybe more importantly, an Office of Management and Budget document called OMB A119, which is the implementation guide to the federal agencies. It's a very valuable document to look at because it does help you understand the federal government's perspective on standards, which is informed in technical development and efficiency, but also informed by our international trade obligations in the WTO Technical Barrier to Trade Agreement and other trade agreements, which see standards as one of the primary vehicles for governments around the world to use to satisfy regulatory needs, while at the same time minimizing barriers to trade for industry. Some of the important conversations that I'll echo from Dan's remarks is that we should be looking to enhance the engagement of diverse stakeholders in the process. That always yields better standards. Industry is generally a fulsome participant in the standards processes for those standards which have a direct material effect on their business. But we also have to reduce barriers for researchers, test laboratories, academia, practitioners, and small and medium-sized enterprises to participate in the standards process to make sure that the best technical ideas are tabled in that consensus process that Dan described so well. And standards aren't just for product performance. We tend to think about PPE and PPT and standards as the standards for the mask, the hard hat, the respirator. But there are also standards for fit, as was mentioned earlier, also application, care, and maintenance, which are very important. And to this discussion, an extension of those standards for the supply chain management itself and standards for data. So data from the supply chain can be interoperable and used by the entire enterprise of users that need to understand information about the applicability of PPE and the accessibility of PPE. One of the other interesting areas that we should be thinking about is how do the standards used in our system interface with the standards used by other countries? There's an international standard setting processes. As a matter of fact, there's several of them. Some of the important ones in this space are carried out by the International Organization for Standardization, ISO. In the United States, ANSI, who was mentioned by Dan as well, is the member body for the International Organization for Standardization and Participation from the US, and mirror committees are formed to bring US input into that process. As we look at the value of consulting with the international standards system in this particular area, we can think about whether harmonization with those standards, whether we should draw upon those standards for our requirements, whether we should look to align the technical requirements of standards used for PPT and PPE in the United States with those standards. And at a minimum, we should be keeping an eye on those standards to avoid developing mutually exclusive requirements. The industry benefits from a low barrier global marketplace. And if we create standards technical requirements that force them to produce products for the US market that differ from products that they want to sell or can sell in other markets, that can hamper supply and supply chain issues as well. A mapping of the technical requirements for PPE and PPT for standards that are used here in the US against standards that are used in other regions, particularly in areas where they have manufacturing capability, would be valuable. And a regulatory assessment of our capability to minimize the barriers to using PPE and PPT that's been demonstrated to meet other regulatory systems can really be a thoughtful way to think about surge moments in time in emergencies when a supply of PPE is necessary and strained. So those are some of my initial thoughts. I think the report points out some great technical areas that standards should also be looked at. Thank you.
Thank you so much, Gordon, for those words. Very much appreciated. And now I'd like to invite our next panelist, Stu Evenhagen from ASPR, to speak. Good morning, Stu.
Good morning, everyone. Can you hear me okay? Excellent. Thank you so much. And I'm very excited to be here this morning and speaking with this panel. I'll provide just a little bit of an overview of remarks, and then when we get into the question and answer, if there's anything we need to drill into more detail, happy to do that then as well. So I'm Stu Evenhagen. I'm the Acting Strategy Branch Chief at the Administration for Strategic Preparedness and Response. ASPR went through a name change last summer from Assistant Secretary of Preparedness and Response to Administration for Strategic Preparedness and Response. What that means is we had our operational role in the COVID pandemic recognized as becoming an operational division in Health and Human Services. But I'll have some reflections over the last couple of years and then an acknowledgement of some of the next steps of where we're going forward. So to take just a couple of steps back to think about supply chain resilience, there was an executive order 14001 that it was on America's unsustainable public health supply chains that called for a national strategy for resilient public health supply chain. So that was released the summer of 2021. It's available online. I can put the link in the chat in a moment here. But that strategy had sort of three main sections that I'll sort of talk us through and then highlight how this work feeds into it and continues to develop on some of those principles. So the first third just defines what we mean by supply chains and public health supply chains and resilience in particular. And then the middle third talks through goals and recommendations and specific actions that the U.S. government is taking in partnership with the private sector. It calls for public-private partnerships and other mechanisms to do that. And then the last third looks at the lessons learned from the COVID-19 pandemic, but acknowledging that the executive order was calling for resilience against future pandemics. So in the midst of the response, we still had to have an acknowledgement of what improvements, adaptations, resilience efforts we might need to think about for future pandemics. So the scope of that document is 10 years. So through the course of the 2020s into 2031. Now, let me say, when we talk about resilience, there are a number of ways to measure or define resilience. It's one of those items that's similar to innovation or risk, that of course can have multiple different ways to think about it. For the purposes of this, we looked at three pillars of robustness, visibility, and agility. So specific to sort of public health supply chains as a remedy to some of the things that were observed. Robustness looks at diversity of sources as well as redundancy of sources. So having more sources of supply, also bolstering diversity of sources for onshoring, nearshoring, and offshoring. So not all having just one source where possible. And visibility looks at, of course, transparency and supply chain illumination and a better ability to be able to see the problem. And then agility is a little bit where those reactive capacities come into play. But it's something to note on all three of those elements is that we want to make sure that we also think about the behavioral element to resilience, which is that it comes down to decisions and it comes down to networks and the experience of the staff involved. And so in many ways, we also want to make sure that we don't lose that It's not like you could just build a system that would fix it all. It's about building a system that includes some of those both hard skills and soft skills, frankly, when it comes to being able to interact within that. But to get to the medical products that we were talking about, it had a couple of domains: PPE, of course, testing and diagnostics, devices such as ventilators and other medical devices, and then the pharmaceuticals. So all of that fits under this umbrella. For PPE, you'll see a lot of that in the lessons learned piece of that document. And one of the things I'd like to highlight there is that we also recognize the need in the discussion with the different participants that sometimes you can have an innovation from product in the type of product that you have, and the standards certainly help to identify those. Sometimes you can also have an innovation in the process, and we don't want to lose sight of that either. So the process innovation are things like CDC NIOSH now owns the trademark to N95. I see that as a process innovation that has allowed more enforcement discretion for counterfeits, because of course we had a flood of counterfeit products during the pandemic that exacerbated the problem of being able to get the right product to the right user at the right time. And of course, then we also saw some issues related to demand shocks. So there was a surge in demand that meant that there was product in the system, but it wasn't always evenly distributed. So better understanding where certain pieces are in the supply chain to better smooth out allocation, that's also a process innovation. So all to say, there are a number of ways that we are looking at and have looked at improvements in medical product supply chains to improve resilience, particular to PPE as well as other products, and that work is ongoing. And just to highlight again to another document, there's the 2022 has a National Biodefense Strategy update, and one of the action items in that calls for a assessment of public health, healthcare workforce, other critical infrastructure, essential workers, and in order to better outline what the full need for N95 personal protective equipment might be. So the work continues, and there's a lot more to talk about in this space. I just wanted to give that sort of conceptual framework, and then we can add in questions and different items that might come up in the chat.
Thank you. Thank you so much, Stu. And next, I'd like to move to our next panelist and introduce Professor Özlem Ergün from Northeastern University. Professor Ergün is also a committee member of the National Academy of Science, Engineering, and Medicine Study on the Resilient Medical Supply Chain. Welcome, Professor.
Thank you, Tanner. Good morning, everyone. So what I will be doing today is basically going over some of the main recommendations and the frameworks that were described in the National Academies National Academies consensus study that we did over the last 2 years, which got published in 2020 February or March 2022. Next slide, please. So this study was on building resilience into the nation's medical product supply chains, and it took. I mean, we did focus on a spectrum of products, including drugs and other medical products. So it wasn't particularly on PPE, but it did discuss PPE in a greater extent as well. Next, please. And I must add that actually having Stu's conversation, I mean, or discussion before me really helped, because all I'm going to do is really kind of reiterate some of the things he just said. So what I want to do is I want to emphasize a few of the insights that we wanted to emphasize most greatly in the study. So first of all, medical product supply chains are complex, multi-stage global systems that involve people, processes, technologies, and policies. So they're complex systems. And furthermore, the medical products themselves can be divided into many different categories and subcategories and sub-subcategories. So first of all, we can think about drugs and medical devices. And then within drugs, we can think about originator drugs versus generic drugs. Within medical devices, we can think about simple medical devices, complex medical devices. But even within these categories, of course, the particular products or particular subcategories of products actually have very different production processes and supply chains. And hence, next slide, please. And hence, one of the most important things that we want to emphasize is that for building resilience into our medical product supply chains, there is no one-size-fits-all strategy. And this is because all these types of different products come with different supply chains, different market structures, different risk profiles. And given all of these differences, really, there is a challenge to match resilience measures to products in a cost-effective manner. Furthermore, we realize that medical product classification schemes currently, the current medical product classification schemes are based on clinical importance mostly. However, there is really a need to include shortage risk and supply chain, and shortage risk that includes the supply chain risk into these classification models. So we would like to recommend, as the committee, we recommended the term supply chain critical medical products as those that are both medically essential and vulnerable to shortages. Next, please. And next, please. So the committee suggested a framework that looks like the visual that you're seeing right now. And what we have done is really we divided the resilience measures into 4 different categories, starting with the awareness measure, which is kind of at the bottom. And we wanted to emphasize this awareness measure because we believe that the awareness measures are precursors to all the other resilience measures that should be implemented. And in a nutshell, what the awareness measures say is that we have to have data sharing and data availability and visibility in the supply chain for making better decisions. Furthermore, we need to have the analytics know-hows that will actually help us to convert data into actionable information. And that actionable information should be communicated at the right time with the right stakeholders. So then if we move up to the upper layer, what we have done in terms of coming up with different resiliency measures, we said that, okay, a trigger event happens. After the trigger event, we should have, well, not after the trigger event, but when the trigger event happens, if there is a right set of mitigation strategies, such as hardening the production processes or diversifying the supply chains, we will make sure that some of the impacts of the trigger event will get reflected from this shield and will not really turn into or kind of contribute to an actual event. However, no shields are without holes. So some of these kind of impacts will actually go through the mitigation shield. Then we have to build a preparedness shield that kind of considers resiliency measures such as stockpiling, capacity buffering, contingency planning, and so on and so far. And this shield will actually prevent some of the actual events turning into shortages. However, again, this shield will not be perfect either, and it will have holes. So some of the events will actually turn into shortages. And then our last shield, which is the response level, will help to reduce the harm. Even if there is a shortage, it will help reduce the harm to the actual people and to the society. And in terms of that committee, we really focused in terms of the definition of a resilience to really mean all strategies and all actions that will lead to reduce harm to the society. Next, please. And then the final thing that I would like to say is we also wanted to emphasize that there needs to be a mapping of resiliency measures to the risk profile of the supply chain. And when we talked about the risk profile, we were really looking at it in 2 dimensions in terms of the likelihood of the disruption on the y-axis and the impact of the disruption on the x-axis. And what this really means is that if we have a product and a supply chain that has a low likelihood of a disruption and a low impact of a disruption, the resiliency measures that we would have to think about for this particular product will be very different if the likelihood of disruption is kind of medium with a high impact. So, and I like to end here, and I'll be happy to take questions later on. Thank you.
Thank you so much, Professor, for your comments. Thanks to all of the panelists. I'd like to invite all of our panelists to turn on their video camera as we move into our discussion section of this portion of the workshop. And first, let me start off by thanking everyone for their very insightful comments. It certainly has provided a solid foundation for all of the different topics and challenges that we're going to be discussing today and tomorrow, and really elevates the complexity of this issue of building resilience within the PPE and PPL supply chain. And I very much appreciated Stu going over, sort of the definition of resilience that was listed in the national strategy for a resilient public health supply chain, thinking about resilience in terms of robustness, agility, and visibility. So what I'd like to do first, and I just really love Dan's comment, that standards are the shorthand of commerce. And I'd like to open it up to the group first to talk about just basically how can we use better defined and clearer PPE and PPT standards and guidance to advance supply chain resilience as to what the professor just mentioned in terms of really building resilience in those critical supplies that we need to anticipate before the trigger event occurs. I'll open that up to the group. You may all want to come off.
There we go,
Yeah,
yeah.
thanks, Dan.
One of the important things is to ensure that standards are written in performance terms. Don't write standards that include material specifications if these specifications are not necessary to the performance of the product. Because if you make your standards performance based, then new technologies that offer the same or better protection can become part of that standard and can be covered by that standard.
Great, thank you, Dan. And I know, Gordon, you mentioned so many different things in your presentation, but the importance also of reducing barriers to participation in the standards consensus process. And many of you mentioned the importance of engaging organizations and participants to really be more vocal and more participatory in that standards process. Can you elaborate a little bit on reducing barriers and the power that would have to contributing to building resiliency?
Certainly. So barriers to participation come in different forms for different participating stakeholders. For small and medium-sized companies who NIST is having a lot of conversations with, especially in the high technology standards like artificial intelligence and other areas, they don't have enough personnel to make the time commitment who can effectively participate, contribute, and influence the outcome of standards. So how can we help that community bring their concerns and their ideas into standardization? I think we also are challenged with academia. Academia has a benchmark judgment. For most academic researchers, it's about publishing papers and having those papers cited. It really isn't about participation in the development of international standards, even in areas where they're doing research that could contribute. One of the interesting developments that we've assisted with in this year is the National Science Foundation's guide for awards in 23 includes international standards participation as a selection factor for research project acceptance, as well as allowing NSF funds to be expended for participation by those researchers in international standards. Also important because a lot of these performance standards, if that's the kind of standards we're talking about, the evaluation, the assessment of product performance is going to be happened at laboratories, and the laboratory staff have a keen understanding of what it means when you translate performance objectives into laboratory test methods and measurements. And they often provide tremendous input in making sure that the standards are clear, and that whether a product is tested at a laboratory in one country or in one location or another, that we can reasonably expect the same answer if we give the laboratories the same products to test. And I think all those things provide a platform to improve standardization by drawing more participation in. I'd also highlight what we heard about diversity in the supply chain having a leg for the potential to be evaluating and looking at the relevance of international standards and standards that are used in other countries. As we all know, during the peak of the pandemic, there was a lot of explanation on television about what a KN95 was. And quite frankly, there was also a lot of products being solicited as KN95s that didn't seem to meet the minimum performance requirements of KN95s when tested in laboratories. And so I think looking at the possibility of leveraging common sets of technical requirements in order to improve supply chain diversity could have a tremendous impact on our ability to respond in areas where diversification of the supply chain has value in response.
All incredibly valuable comments. And, as I'm reflecting, as I'm listening to you speak, the value of this workshop, wanting to advance this work and having this as a venue to pull together academics, manufacturers, laboratory technicians, regulators, to have that improved communication and awareness of things that you've mentioned, such as the National Science Foundation Awards. And earlier in your talk, you talked about the guiding lights, that are available, those reference documents that people can use to advance the standardization process. So thank you, Gordon, for those comments. Stu, I wanted to go back to you. And we're seeing basically the movement of personal protective equipment and PPL from the occupational setting to the public eventually, right? And we know that we have those gaps there. So not only are we thinking about building the resilient public health supply chain for healthcare workers and critical, essential infrastructure workers, but eventually to the public. And you've mentioned quite a bit of work that's going on at ASPR. We do see these major gaps in terms of not having standards for the public, and other gaps when you go beyond PPE, beyond respirators. Can you just elaborate a little bit on how ASPR is approaching this issue?
Yes, and I just also want to of course, the importance of standards for the end user. They help them assure to them that the product is going to do what they expect it to do, and those have different profiles for occupational settings, particularly for healthcare occupational settings, and then of course other essential workers, and then for the general public. And ASPR has a number of efforts underway. There's a partnership with CDC NIOSH and BARDA Drive on a mask innovation challenge that's been posted on their website, and there's some awardees announced for that. And so that was an exciting way to sort of look at different product types, both for different users like the general public, as well as what you could apply to occupational settings. I would also highlight that a follow-on report on the public health industrial base outlines that as a little bit more of an overarching concept than just supply chains, but that would also include uses for general public health, which include the public. So there are a number of different areas where the U.S. government federal partners are involved. ASPR is one of those, but there were 9 themes that were laid out in that report. ASPR is involved in maybe a third to half of them, but some of them were also on trade policy and on other, other issues that sort of fall outside what we do. But there's certainly quite a bit with the strategic national stockpile and stockpiling PPE that we can do, and then with a better supply chain elimination, to better, of course, see what we can do for allocation. And then on the product innovation side, looking at new types of PPE that could better help be applied to multiple users. So if I had to summarize that, I would say that we are trying to make advancements across all fronts, also and including improvements in domestic capacity. There's certainly a lot we can do on the international front and on international trade, but also having some capacity for international production is one of those pillars to that as well.
Great, thank you. And further on in our workshop, we will be further exploring and diving into some of those comments that you've made in terms of the spurring innovation in next generation respiratory protection, such as the Bar to Drive initiative, and then what really needs to happen in terms of public-private partnerships to sustain a marketplace that will continue to allow for innovation and development and contribute to that resiliency. I'm going to pause. Oh, Gordon, you've got your comment.
Thanks.
No, sorry, that's exactly right. And just if there's more types of products available for certain types of users, then that has the effect of decompression and improving allocation.
Exactly.
So I just wanted to point out, as part of this discussion, that in the partnership that is standards between the private sector stakeholders and the government, NPPTL staff led in the development of a standard called ASTM F3205, which is a standard for facial barriers. It's a source control standard. I call it the community mask standard. It's the kind of mask performance standard that we would expect people who are going to the grocery stores and may want to use source control during pandemics or other events. And this was a brand new standard, and it was really created from scratch in a very short period of time. I think we took it to publication in about 9 months. NPPTL did a great job bringing the stakeholders together in the ASTM forum to develop this. I participated directly and wrote the conformity assessment requirements that were inputted into it and considered in the consensus process. And I think this can provide the kind of an example where we're looking to bridge between a standard that's suitable for an occupational setting to a standard that's suitable for a ordinary citizen everyday use standard, which has a couple benefits. One, we can bring a product to the market that perhaps is more usable in that environment, a little bit more comfortable to wear for ordinary folks every day, easier to use, easier to understand, maybe doesn't need the kind of fit requirements that we see in occupational settings, and can relieve some of the pressure off of the devices that are really needed in the healthcare sector and in occupational settings, where you're really looking for respiratory protection. Thanks.
Thanks, Gordon. I'm going to take a few questions from the audience now. And one is that many standards have had decades between updates. Would it be better to have more frequent periodic review and update of these by consensus committee to allow them to accommodate new technologies and needs? And also, should we create a single document rather than have requirements sent out across the main document with test methods and letters to manufacturers? Any thoughts on that?
Well, on the timeliness question, most standard development organizations have a lifetime for their standards. ANSI standards, for example, are supposed to be reviewed, revised, every 5 years. So if a standard has gone 20 years without a revision, it's possible that the organizing body behind the standard looked at it every 5 years and said, yeah, this is still good enough, although they are supposed to indicate that as part of the nomenclature of the standard. But the general principles are standards do not last forever. And the process of developing standards actually is a continuous process. Once you publish a standard, you're generally starting work on the next edition the next day.
Right. Thank you. Thanks so much, Dan. I'm going to pivot a little here and go back to raising some questions about the public in terms of the standardization process as it relates to PPE for the public. And so a couple of different questions, which I'll pose and then let people take turns responding to them. So Dan, how can we better find out the need from workers and the public? And to Gordon, how can we engage the public as stakeholders in NIST work? And Stu, how can we inform and protect the public when innovation does happen? And you mentioned, the KN95s versus the N95. And then finally, to Professor Ergen, might we learn anything for PPE, PPT supply chain issues from the recent baby milk shortages? So Dan, do you want to weigh in on how we can do a better job of finding out the need from workers in the public?
Well, the question of need involves research. I mean, do research into the sorts of hazards that are facing the public. There was a report published by the National Academies on respirators that came out in February that went fairly deep into that, identifying the need for protection for the public against biohazards, obviously, but also things like wildfire smoke, environmental pollution. But there has to be research to identify the need. There's a lot of PPE available to the public. If I'm working around the house, I can go out and buy a pair of safety glasses, which is exactly the same PPE that is used in an occupational setting. I can get earplugs if I'm doing something that's noisy. I can even buy a respirator. The difference is if I'm using it in an occupational setting, somebody is doing the hazard analysis. Somebody has decided what the hazard is and providing the appropriate PPE. That kind of guidance, to me, is what the public needs more than anything else. When do you need PPE? What kind of PPE do you need?
Yes, and that was a great report in terms of the National Academy of Medicine report on protecting those individuals who are workers who may not have a respiratory protection program,
Right.
Or to the public, and certainly to multiple hazards. I think it's so easy for all of us as we're in year 3 of the COVID-19 pandemic to constantly focus on SARS-CoV-2 and respiratory pathogens and concern about other pathogens with increased transmissibility and pathogenicity, but we have to remember the multiple hazards that people face and the fact that we have to think about a broad supply chain of PPE across a number of different hazards and constantly measuring and reevaluating that risk. And I know Professor Ergen in her comments about, really identifying the supply chain risk and critical medical products for that certainly goes to that. Gordon, you're up next.
Thanks.
How can we engage stakeholders?
So NIST has a long history of engaging stakeholders in our research work. NIST just published something called the Risk Management Framework for Artificial Intelligence. There was a tremendous amount of public stakeholder engagement, both through the Federal Register and written responses, but also through in-person meetings and virtual opportunities. But that is toward a NIST document product that it really isn't a standard, it's a framework. Our work in standards is generally participating with manufacturers, academia, and others in the development of voluntary consensus standards like those developed in ASTM that are popular in the personal protection equipment and personal protective technology space. So I think the question of that participation has to do with how does the standards development community actually look to lift up those voices who don't typically either know about the standards development or don't have the opportunity to participate in the standard. There's a couple of answers. So many standards development organizations have programs to enable people who represent the user and consumer communities into the standards development process. Those come in the form of waiving membership fees where membership fees are necessary. Usually the membership fees are small and not a tremendous impediment, helping the new entrants into the standards development process understand how the process works and how they can contribute and be influential in the process. And I'll tell you, when I worked at Underwriters Laboratories, one of the things that we did to help consumers who wanted to understand the product safety standards for appliances that were in their home was helping to understand the technical words in the standard and the impact on their experiences with the products. So for instance, we had a standard that had a maximum touch temperature for ranges and stoves used in residences. But our standards were written in a way that described the degree Celsius rise over a 25 degrees C normalized ambient, which is great for engineers who are used to measuring things, but it's not great for consumers who are used to absolute temperatures in Fahrenheit. So we did our best to help those participants who wanted to influence the outcome of the standard understand how the technical language of the standard related to their experiences with the products in their everyday life so they could contribute in a meaningful way.
Great. Thank you so much for those comments. Stu?
Yes, and thank you. I really like this question, and just reflecting on my own thoughts on communication in general is that you're never done. You can communicate, and it is never a line segment. It's always a ray. You start that communication, and it just continues on. And that, well, actually, sorry, the geometry's flawed. It's better when it's two-way. You actually want to make sure that you have ongoing dialogue with stakeholders to better understand their needs and think about where we are. And so all that's to say, for our communication to inform the public when innovation happens, it's something that we certainly have a commitment to with our external partners. And there's social media platforms. There's we put out information there and on websites and in fora like this. But there was also, that was even highlighted as well as one of the objectives in the national strategy, was to improve coordination across relevant stakeholders for the purpose of information sharing and communication, and to develop an integrated approach to communication mechanisms. So sometimes those can be formal, sometimes those can be informal, but better realizing that at the root of the problem is better identifying what you need, when you need it, and who needs it, so that we could be able to say, for example, for a PPE that was useful for the public, to be able to say this or these are the types of items you might need to think about for the type of protection you require. The next pandemic might not be respiratory pathogen. We have to think about that there's no guarantee that we'll be faced with the same challenge next time, but better at being able to identify what the types of products that are needed so that the public can make an informed choice.
Excellent. Thank you, Stu. And now over to Aslan.
So I guess the question is, what might we learn for the PPE and PPT supply chains from the recent baby milk shortages? Unfortunately, I would say the baby formula shortages is also already a thing of the past. I mean, after that, we had the shortages on the children's Tylenol and Advil. Right now, we're going on to shortages with Adrenal, right? And the truth of the matter is that medical product shortages and drug shortages particularly is an endemic in this country, as well as in the European Union and many other parts of the world. So there is something, I mean, there are things that are structural in this marketplace and the supply chains that actually causes these shortages, even without big disruptions. So, I mean, do we learn something new every time that a shortage actually hits to the front page of the popular newspapers? Of course we do. We look at it and we try to understand it. But at the end of the day, we already know what needs to be done, right? We really need to look at these supply chain. We first need to identify supply chain critical products, and kind of going back to the comment or the question around the timing, these product lists have to be updated because we live in a dynamic world, and criticality of a product or the risk of a supply chain actually does change, right? These things change. So we need to have some organizations, committees looking at these, identifying supply chain critical products, and then really doing an analysis of their supply chains and the impact, and understanding vulnerabilities and risks associated with these supply chains. And if I may kind of like respond to the next question on the chat, which was actually looking at like, are there any stress tests, right? Are there any simulations?
Right.
I think it's an excellent comment. And if you look at, for example, the banking sector, there are stress tests, right? The banking sector has to do stress tests and identify vulnerabilities within their systems. Similar things, I believe, must be done at least for these supply chain critical products. Unfortunately, again, coming back to the data transparency and awareness, it is we do really not have enough information and data to perform these simulation exercises at this point. But I think it is really something that we should do in the future.
Yeah, certainly we need that data and the ability to keep it current and analyzable and shareable in order to build that agility, so that there is that ability of the public health supply chain to pivot operations and to return and sustain function, going back to what the national strategy says. Let me pose another question from our audience. Identifying legally marketed and approved PPE or PPT with the right fit, the right protection, all of the right components can be very challenging. Do the speakers have any thoughts or suggestions on how to improve this challenge for the public and for federal purchasing programs? So basically, how can we use the standardization process to clarify public and or federal purchasing programs? Gordon?
So I'll just say that when we're designing products, we have to really have the user community in mind. I think you can look at home health devices and devices that are intended for use in healthcare settings by healthcare professionals. You look at them and you decide that there's reasonable levels of use and abuse that need to be considered in the standard to make sure that the products that meet the requirements of the standard are reasonably safe and effective. From a fit perspective, if we're conceiving that a home user who goes to a store and buys a respiratory protection or a source control device off the shelf is going to have the same kind of a fit regime as we see in a regulated occupational setting, we're really not doing justice to the user community and the standard. So as we write standards transitioning some of these areas of PPE to home use and residential use and community use, we should be thinking about how those products will be used, how they'll be reasonably abused, and designing the standard to the greatest extent to design out hazards and design in performance under those conditions of use.
Excellent. Thank you so much. Well, at this point, oh, I'm sorry, Stu?
Well, I'll be real quick, just to add to Gordon's comment there. As we're thinking about the entire system, in some ways, stockpiling is useful for some products to have decompression on the total demand. That has a challenge to it. There's no one solution. There's a portfolio of solutions, but the stockpiling, of course, then runs some of the issue of shelf life and having the right amounts when you need it, and the challenges that happen there. Then there's allocation and making sure they get distributed within the system. There can be sharing agreements. There can be reciprocity. We can have inventory bubbles that vendor managed inventory that producers and distributors can supply. And then once there's post-purchase, there can be arrangements as well that can help. For example, being able to have fit testing for healthcare workers across multiple PPE types, so that they aren't reliant on just one particular product type, but they could take from a variety of different manufacturers N95. That ends up being sometimes a constraint on that end, and that then frees up the ability for everything else in the system that we need to think about as well. So it all comes down to better being able to streamline and smooth out all of the products that are available, the need that different users have, and then being able to get to sort of that in a prioritized process, so that in the end we're all better able to manage and get to the other side of a shock and a pandemic.
Right, great points. And later on in the workshop, we will be looking at stockpiling, as a challenge, and also as a way of strengthening resilience, and then looking at distribution and all of those topics that you've mentioned, which are so critically important. I'm afraid we've come to the end of this wonderful session, and I have to sincerely thank all of the panelists for sharing your time and treasure and your expertise as it relates to the standardization process and building a more resilient supply chain. Your insights have been invaluable, and I think we've really established a solid foundation for this very important workshop. As Linda mentioned, every life is important, and we're all very committed to the protection of our workers and protection of the public. And I want to sincerely thank you all for participating in this session. At this time, I'm going to pass it along to Jill Morgan, who will moderate the next session, which will be addressing the COVID-19 experience and what lessons we have possibly learned from the past 3 years of responding to the pandemic. Thank you, everyone.